Let's face it, many adult palliative doctors want nothing to do with pediatric palliative medicine because they think it's too scary and too sad. There are lots of reasons why. Prescribing medication for kids involves a lot more math. Lots of pediatric life limiting conditions are rare and esoteric. We've been told many times over that kids are not just small adults. And this is very true, but it can make us feel like we have no idea what to do. And maybe, more than anything else, there's just something intrinsically wrong with kids being really sick and dying. I understand all of this. Neurologists are required to rotate through 3 months of pediatric neurology during residency, and those 3 months were by far the worst and hardest part of residency for me. Every story seemed tragic. I didn't know how to interact with the kids, and it was really hard being in the presence of so much suffering when it came to the parents. Very ironically, I became one of those parents years later when my daughter ended up having a terrible neuromuscular disease. My family is okay today largely because we got palliative care. So, part of my life's mission now is to spread the word about the importance of pediatric palliative care, and this video series is an attempt to do this. I want to help bridge the gap between adult HPM providers and the world of pediatric palliative care. We'll talk about some of the things that are more unique to pediatrics, things that an adult practitioner may not know or have trouble understanding. Most importantly, though, I want to bring in the family's perspective, the things you can't read about in books. To do this, I'll be drawing some things from my own experience, but the majority of this content will be from Courageous Parents Network, an organization that supports and equips families and care providers who take care of children with serious illness. But first, let's make the case for why adult HPM providers should learn about pediatric palliative care. Number one, the shortage of palliative care is even greater in the pediatric population. Up to 17 million adults are caregivers for a seriously ill child, and there are upwards of 400,000 kids currently living with complex conditions. 15,000 kids die every year from conditions that could benefit from palliative care. Almost all hospital based pediatric palliative care programs are in urban areas, so there are many parts of the country that are uncovered. So, even if you have no intention of including children in your practice, you may find yourself in that role simply because there's no one else. Second, we have a lot to learn from pediatric palliative medicine. Knowing our patients as people is at the very heart of good palliative medicine, and this is more naturally part of the culture in pediatrics versus adult medicine. There's a lot more focus on the child rather than the disease. For example, it's pretty common in pediatric hospitals to have an all about me poster that introduces you to their family, their favorite color, etc. This is not something we really see in adult hospitals. Ancillary services like art therapy, animal therapy, I've even seen a visiting llama, are a lot more robust in the pediatric world. There's more care put into making their environment fun and appealing. It's just accepted that kids need to play and imagine, and more resources are put into helping their quality of life. Adults need these things too. Taking a step into the pediatric world reminds us of this and hopefully gives us some inspiration. Number three, you will meet amazing families. Yes, the death of a child is harder than anyone can imagine, and it goes against the order of things, but there's also beauty, purpose, joy, and humor in their journeys. It's both humbling and a privilege to be a part of the team that helps them with the hardest things that anyone will ever face. Lastly, I just want to say don't be afraid of the parents. It's the old joke in pediatrics that the children are fine, it's the parents who are hard to deal with. With parents who have kids with serious illness, there's a tendency on one hand to put them on a pedestal and think of them as saints or superheroes. On the other hand, they may have a reputation as being very demanding. Parents are just people doing their best in an awful situation, and we have a huge opportunity to help them. This mom from Courageous Parents Network, for example, is just very real and honest and normal. How can anyone not want to do their very best to help her?
But then there's this whole other part that I always laugh about inside because I want to say, oh, it's made me so patient. Oh, I appreciate, my son so much more. But that is just not the case. And the reason why is because you're exhausted all the time. You are irritable because you don't get any sleep. You get no private time. You're tired. You're anxious. You're all of these things. So, I think later in life when Brooke maybe is not with us and I'm not feeling all of those things where I'm getting a good night's sleep and I'm not anxious or, feeling the constant anxiety. And I think it will change me. And I think that I will have a bigger appreciation for, all of those things that people expect you to say that you gain out of this situation. But while you're living it, no, you don't. I yell all the time. I'm tired. It's just not that way right now. But I'm learning those lessons, and I know that they're making an impact on me. But I'm just not capable of practicing them right now because I'm too tired to.